Are you a doctor who has a hard time getting your patients to understand diabetes? Are you a diabetic patient who is having a hard time understanding your doctor? Then we have the right app for you. Introducing VMR, Virtual Medical Records. In VMR, you're able to visualize, understand, and interact with your diabetic health information. Using the Oculus headset, patients can interact with their health information in a virtual world. Patients can get a clear idea as to what exactly a glucose curve is, why managing their A1C is important, and why taking care of these will prevent eye and nerve damage. Managing your glucose levels can be difficult and daunting. However, our goal is to provide doctors and diabetic patients with something interactive that can help patients understand the importance of taking care of your glucose levels. Change your habits, change your life. In recent years, the costs of diabetes intervention in hospitals rose to the billions. What we hope to do with VMR is to supply doctors and patients with a low-cost solution to diabetes intervention. This in turn will save hospitals millions that they can use towards research and development. Let's take a look at the experience. The hub connects the patient to all the experiences. First is the mountain experience. The mountain experience explores your glucose curve. The ridge of the mountain represents your daily glucose curve. You can traverse to and from the peaks that represent your glucose level at that time of day. The higher the peak is, the more dangerous your glucose levels are in. Next is the bar graph scene. Here you get to compare your A1C to a healthy number and the goal your doctor would like you to reach. Your A1C is an average number of your glucose levels within 3 months. This is how doctors monitor if you've been staying healthy or not. Finally, there's the retinopathy experience. Retinopathy is a diabetic eye disease that affects the cells in your eyes. Patients are allowed to view the museum through healthy and damaged eyes. By visualizing what it is like to have the diabetic eye disease, patients will understand the difficulties through sight of those who have retinopathy. So far, we have done a few preclinical testings where we had non-diabetic and diabetic patients test our app. And the results were positive, empathetic responses. We want to utilize the power of empathy to convey our message, and so far we are headed in the right direction. Thank you for your interest in VMR, and we hope to see you soon.